And when in doubt, ask for a second opinion with another doctor who isn't going to see you, but you just wanted someone's opinion without a financial interest in you. Hey, it's Dr. Lin with Empowerment Physical Therapy, and today I want to share with you another principle that we educate our current clients with to help accelerate their recovery. And it's called conservative before invasive. As a physical therapist, I have the bias of being conservative rather than being invasive, where a surgeon is sometimes might come from the aspect of being invasive because that's what their training is. Pick up the knife, cut, get you open. That's what they were trained with a knife. We were trained with our hands. So a physical therapist will usually come from the aspect of being conservative, whereas a surgeon with their training is going to lean more toward the aspect of invasive. There's a time and a place for it. In the case of, there's a time and place for surgery. I'm not advocating that you shouldn't have surgery. There's a time and a place for that. There's a time and place for PT as well. And it's one of the reasons why we don't take every patient on that calls us. So in the case of somebody who was involved in a car accident and has multiple fractures, as a physical therapist, I can't treat that person until the surgeon has stabilized those fractures. And that when that fracture has healed to a certain extent, or if the surgeon wants us to kind of have the other joints worked on to make sure, because of that cast, that other body parts doesn't get compromised. So in the case of that, the patient has to be stabilized first. So the invasive aspect is necessary before we work on the conservative aspect of things. Now, in the case of somebody who has chronic knee, hip, or acute back, neck, and shoulder pain, opening you up is probably not the best thing, where it makes sense to start with conservative measures before opening you up and having you go through surgery. So those are some of the things that you should consider as you're going through and getting recommended for conservative treatments. And if you don't want surgery, there are other alternatives. For me, I'd rather exhaust my conservative efforts before I go invasive, because I know that option to open me up and have the surgeon go under and kind of dig their knife into me is always going to be there. So that's my philosophy. And that's how we kind of approach a lot of the things. Because I've seen patients who was coming in with a knee pain and walk out of the surgeon room with a total hip replacement that didn't solve the knee pain and that she didn't need a hip replacement. Kind of crazy to think that that patient went in with a knee pain and was recommended for hip replacement. So those are kind of things I would think about. And when in doubt, ask for a second opinion. Ask for a second opinion with another doctor who isn't going to see you, but you just wanted someone's opinion without a financial interest in you, because they'll probably give you more of an honest answer of what they would do if you were their patient. So those are the things that I would have you consider when you think about how to handle an injury.